I'm Keisha Thomas, and I will be the nurse during your health history today. And your name is?
I'm Lauren. Okay.
Nice to meet you, Lauren Patty. And what would you like for me to call you during this exam?
Lauren.
Okay, Lauren, I'll do that. Okay, Lauren, so today you're here because of what chief complaint do you have today? What's going on with you?
Now, I don't have any complaints, but I am new to the city and looking for primary care.
Okay. And how old are you? What's your date of birth?
My date of birth is January 20th, 1995.
Okay. And do you have any health history or present illness at this time?
No.
Okay. And are you allergic to any foods?
No.
Okay, did you know what? Are you allergic to any medication?
No.
Okay. And are you allergic to any dust in the air or grass, ragweeds, or anything like that?
No.
Okay. And what about latex gloves?
No.
Okay. And are you taking any medication that is prescribed for you right now by a physician?
I am. I take Zulane birth control patch.
Okay. And how do you take the Zulane birth control patch?
I wear it for 3 weeks, and on my 4th week, I take it off.
Okay. And do you take any vitamins over the counter?
I do. I take a probiotic over the counter.
Okay. And how about anything else such as ibuprofen or anything for allergies?
I do take something for allergies. I do take a Chlortab tablet daily, and I also take Aleve or ibuprofen, as needed with a headache or a migraine or something.
Okay. And so do you just have seasonal allergies when the seasons change?
Yes.
Okay. And last time you've been hospitalized, been in the hospital?
Last time I was hospitalized was on March 9th of 2017, and I was giving birth to my son.
Okay. And it was a single birth?
It was, yes.
And did you have your son vaginally or by C-section?
Vaginally.
With no complications?
No complications.
Okay. Have you had any surgery?
No surgeries.
Okay. And when was your last menstrual period?
August 21st.
Okay. And when was the last time you had your pap smear done?
I have. The last one was October 21st of last year.
Okay. And was it normal or abnormal, your pap smear?
Normal.
Okay. And in the past, have you had any sexually transmitted infections in the past?
No.
Okay. And I'm going to ask you a few questions about your family history.
Okay.
So is your mother and father still alive?
Yes.
Okay. How old is your mother?
48.
She's 48. And does she have any health issues such as high blood pressure, diabetes?
No.
Okay. And what about your father? How old is your father?
47.
He's 47. And does he have any issues with high blood pressure, diabetes?
He has high blood pressure.
Okay. Has either of your parents have had a heart attack or stroke?
No.
Okay. And your grandparents, are they still both living?
Yes.
Okay. And how old is your grandmother?
65.
Okay. And does she have any medical histories that you would know about?
No.
Okay. And what about your grandfather?
My grandfather has diabetes and high blood pressure.
Diabetes and high blood pressure. How old is your grandfather?
66.
And do they get around well for their age?
Yes.
Okay. And do you have siblings?
I do.
Okay. How many?
I have 2 siblings. I have a sister that is 12 and a brother that is 10.
Okay. And do they have any health issues that you know of?
No.
Okay, and so they're healthy. Okay, and your baby, what's your child's name?
Ashton.
Okay, Ashton. And Ashton, does he have any health issues that you could tell me about?
Yes, Ashton was born with a congenital heart defect, hypoplastic left heart syndrome.
Okay. And when was he diagnosed, your baby Ashton, with the hypoplastic left heart syndrome?
I found out prenatally at 20 weeks.
Okay, at 20 weeks. So, once he was born, were there anything that they had to do for him?
Yes, Ashton had open heart surgery at 6 days old.
Okay.
He had his second operation at about 4 months old. his plan of care now, he does take ananapril 0.6 mLs,
Okay.
and he does also take a half baby aspirin.
Okay, and otherwise he's a healthy little boy?
Yes.
Okay, very good. And are you married or single?
I'm single.
Okay. And do you work anywhere in town?
Yes, I do. I work at State Farm full time.
Okay. And do you go to school?
Yes.
Okay. And where do you go to school?
UAB.
UAB. And are you in school full-time or part-time?
Part-time.
Part-time. And what is your major?
Healthcare management.
Healthcare management. Well, congratulations to you on going to school.
Thank you.
And a few more questions. Do you drink alcohol?
Occasionally.
Occasionally. And how old were you when you first drank?
20 years old.
You were 20. And how often do you have a drink presently?
Twice daily.
Do you smoke?
No.
No smoking. And what about any illicit drugs? Do you use any recreational drugs such as marijuana or any other street drugs?
No.
Okay. And exercising, do you often exercise at any time?
No.
Okay. And another question I want to ask you about, do you feel safe at home?
Yes.
Okay. No problems at home, and it's you and your son, you stay together, okay. Do you get your eyes checked on a regular basis?
Yes.
And do you wear contacts or glasses?
Contacts.
Okay. And how old were you when you first got glasses or contacts?
10 years old.
10 years old. And do you go to the dentist?
Yes.
Okay. And how often do you go to the dentist?
Every 6 months.
Every 6 months. And I know that you take ibuprofen for migraines sometimes. Do you have migraines often?
No.
Okay. And do you know what make it comes on? Do you have an aura, or is it certain things that make you have a migraine?
Nothing that I could just tell you offhand.
Okay. And so at this time right now, are you having any problems as far as breathing, shortness of breath, any chest pain?
No.
Do you have any difficulty swallowing or having heartburn?
No.
And with your abdomen, is it often upset? You have a queasy stomach, any nausea or vomiting?
No.
At any time, no problems when you urinate, going to the bathroom, as far as having urgency, going often or not going enough?
No.
Feeling bloated or anything of that nature? No problem with your skin as far as having rashes or any sores or anything on your, okay, any swelling in your feet or legs?
No.
And any pain like bones on your knees, your legs, or anything like that? Okay. So with Lauren, she's a 24-year-old female that came today with actually really no complaints. So right now I do not have a differential diagnosis for her. She complains of having a migraine headache every now and then, which she used ibuprofen to help her with that. So we'll just let her know anytime that she needs to come to us for any medical need that she could come here, and we will take care of her.